I'm only going to give a brief, and I'm sure you have more of a story to tell. So Project Purple was founded on September 15th, 2010, fueled by a commitment to Dino's father, who was diagnosed with pancreatic cancer in 2008. Dino Verrelli rallied a passionate group of individuals to launch Project Purple. Motivated by his father Giovanni's diagnosis, Dino spearheaded the creation of this transformative organization. Today, Project Purple stands as a testament to our community's dedication to rewriting the story of pancreatic cancer. Our organization here, Project Purple, is driven by hope and a shared commitment to making a lasting impact in the lives of those affected by this formidable disease. So welcome and thank you so much for coming and talking to us.
Thank you. First of all, thank you to the chamber and thank you to the health council for allowing us the opportunity. I think I did this presentation, but I did present, I think like during COVID, I think.
Yeah.
At some point, so it's cool to see some familiar faces and a lot of new faces, which is awesome. So as the introduction, Deborah said, I'm Dino Verrelli, the founder and CEO. I've been at the helm since day one. I'll give a little bit of my story, just really brief. My dad was diagnosed in December of 2008. I was in the financial service business, believe it or not. I was actually, I own my own insurance brokerage, so I was kind of the middleman. Our company was the middleman between insurance agents and insurance companies. And was doing really well. My dad gets this awful diagnosis of pancreatic cancer, right? And life changed really fast, really quick for us. My parents were immigrants. I grew up in Bridgeport, but then eventually through college, they actually moved to Shelland. So I guess part of my life was here in Shelland, post-college. And my dad was my role model, my hero. When he got diagnosed, it was really kind of a gut punch. Cancer was not foreign to our family. My mom, my aunt, my grandfather all had different types of cancers, but pancreatic cancer was really foreign. So we knew it was serious. I ended up being my dad and my mom's chauffeur for 3.5 years through that journey. And in that journey, I saw so many cracks. I call them cracks in the healthcare system. This is the healthcare council, right? You guys all do amazing things, but there's still things that we could always do better at, right? And sometimes the systems are just so big that we have to worry about what we can control day in, day out and have positive impact. And I saw a lot of those cracks and I wanted to make a difference. And if you look at the disease itself, pancreatic cancer, it's one of the worst. Statistically, it has the worst 5-year survival rate. Right now it's hovering around 12-13% for 5-year survival. I do think that number is a little off, not a lot, but we see a lot of survivors and there's a lot of reasons why I think that is off a little bit. I think just statistically, no one's out there counting survivors. So there's hope, as Deborah mentioned. We try to provide a lot of hope. But to go back to the disease itself, it's also one of the least funded. I don't know how many people realize, but the government funds 85% of cancer research, all cancers in the world, the US government. What happens here in the US really dominates the world across the globe in terms of clinical research. And so things like, and not to make this political, but the government shutdown, government shut down for 40 days. We just had our medical researchers with us. We have a medical research committee, which I'll talk about. And they were saying like nothing's happening. Like even though if you got grants from the government, the researchers aren't getting paid, right? So you just think about like things like that impact things like that trickle down, right? So with that being said, there's not a lot of money in it. Government doesn't support it, and I get it. It's less than 2% of the overall NIH budget, which is like $4.5 billion. So there's very little that was being done in this space. So that's when I kind of decided, all right, we've got to do something here. And my dad was the original inspiration, but it evolved really fast because I knew really fast I wasn't going to be able to cure my dad or save my dad, but I could help a lot of other people and provide hope. And so that's what we've done over 15 years. So this slide is this is our kind of our homage to, we are in our 15th year. We've done some amazing things. I'm going to talk a little bit about our research because I think that's important. And also in particular, like what we're doing here in the state of Connecticut. We made a major announcement last year around this time with a partnership with Hartford Healthcare. And I'll kind of talk a little bit about that, but also talk a little bit globally, like what we've done with research, because we offer another program, which is patient financial aid. So any patient going through this disease can reach out to us and get supportive support financially. emotionally, and some other things that we are doing from the patient aspect. But I really want to focus on research because that's how we are changing kind of the trajectory for a lot of families that are unfortunately impacted by this disease. So one of the big changes that we made, okay, with research this year. So being our 15th year, we're kind of on this really amazing trajectory in terms of fundraising. And we do a lot. You can check out our website, projectpurple.org. We do everything from running to Daniela runs our community events. So if you're not a runner, we started as a running charity, but we've really evolved and we do everything. So I would say just check out our website to learn how we've raised money. But what we do with it, I mentioned patient aid, but research is a big piece of it and has become bigger and bigger as we started to raise more and more money and we got into the millions. But something that we did this year, I was really excited about, is we put together a multidisciplinary research committee. And we have 5 clinicians along with myself representing the board of directors on this multidisciplinary research committee, which really is kind of like an all-star team of clinicians from multidisciplinary approaches. So Dr. Desfina Solis, who's actually a medical oncologist at Cornell Weill, Dr. Peter Allen, who is a medical oncologist surgeon at Duke. He actually just became the head of surgery of the entire Duke Cancer Institute. And Duke is an amazing cancer institute. We've worked with them over the past couple of years. Dr. Eugene Coy from MD Anderson down in Texas, one of the best cancer centers in the world. He actually is a radiation oncologist, so he brings that specialty to the group. But he also just became the co-director of the Pancreas Center down at MD Anderson. Dr. Jonathan Brody at Oregon Health Science University of OHSU out in Portland, Oregon. Dr. Jonathan Brody is a bench scientist, so he doesn't meet with patients. He's in the back. He works with various specialties and clinicians that do see patients, but he has a huge lab of researchers that are doing, research with mice and with all types of other applications to find cures and better treatments for pancreatic cancer. Dr. Brody is also the co-director of the Pancreas Center at OHSU. Phil Knight, you may know that name, the founder of Nike, just gave OHSU $1 billion for cancer research. So Dr. Brody is the co-director there. Dr. Brett Shipper is the last clinician on the panel, or excuse me, on the committee. He is the head of surgical oncology at Hartford Healthcare here in Connecticut. He's also specialty is pancreatic cancer. So all the folks on the committee all focus in pancreatic cancer. They all come from different specialties or multidisciplinary. So we have medical oncology, radiation oncology, surgery, and then research. So this was really big for us as we move forward in terms of how do we go about helping to find a cure and helping patients get better treatments to the communities throughout the country and throughout the world. Was establishing really a team of, like I call them, the A team of experts in the space to help us guide the decisions that we are making for research for patients and for cures and better treatments. Another interesting piece here, really excited about this, and this is really an epic thing for us at Project Purple. This year, we will pay out $1 million in clinical research grants. We are gonna probably now make an announcement within the next 2 to 3 weeks for new grants. And one of the mechanisms that this group was able to put together really fast, we announced this in June. The government shutdown, I think, was just like 40 days ago, but even prior to that, with the change in the administration, there was a lot of noise or a lot of news about like research just getting slashed like big time, right? And everything was getting looked at, right? So there was a lot of unknowns, but one mechanism, and kudos to the group for doing this and for suggesting this year is we are putting in grants that are for people who had lost funding. And so if you think about like the space is, as I mentioned, doesn't get a lot of funding. It gets less than 2% of the total budget, which comes in around 150, 180 million, which may seem like a lot of money, but it's not. So what we're trying to do is for anyone who got a letter from NIH or DOD, which is another funding mechanism from the government, that said, hey, you no longer are getting funding because of budget cuts. We're coming in and helping out with those researchers. So they've already been scored, they already applied, they've already been granted grants from the federal government, depending on the mechanisms, irrelevant whether it's DOD or NIH. But we're actually coming in and helping them to continue that research. And that's critical right now at this point in time, because you think about it in your jobs. If you're doing your day job and then, hey, guess what? You're not getting paid anymore. You know, like you won't get paid for the next 2 years, but you got to figure out how to continue to do that job, right? What happens? Well, you go find another job, right? In another industry possibly. So we're really trying to keep researchers in the space and allowing them to continue to do all the great things they are doing to help patients and families in finding treatments and finding early detection. So we're super excited about that effort this year and the impact it's going to have. So let's talk about high-risk screening. And really, this is where, we come in and what we put a big focus in over the last couple of years in early detection. So with pancreatic cancer, up to 10% of the cases in the United States are from some sort of genetic mutation. Now, genes are passed on through families, right? I think breast cancer has probably done a great job of this, and I'll mention breast cancer a little bit. Not that we want to compare breast cancer to pancreatic cancer, but if you look at what breast cancer has done over the last 30 years in terms of survivability, in terms of early detection, really is amazing and really has become a role model for the rest of the cancers in the cancer world to kind of emulate and not necessarily duplicate or replicate exactly what they were doing, but can help us in finding early detection and getting higher survivability. So we've been really focused since around 2018 in this genetic population. Again, 10% of the cases in the United States, there's 68,000 people that get diagnosed with pancreatic cancer this year. So that's about almost 7,000 people that have some sort of genetic link to the disease. The one that's probably the most common because of breast is the BRCA gene, right? Probably have heard BRCA, BRCA1, BRCA2, but there's actually 7 genes that are linked to pancreatic cancer and also breast cancer, along with colon cancer, prostate, ovarian, and then melanoma for everybody. So what our focus has been, and this comes back to kind of like the original strategy with research, we have a lot of terms we use, but one of them is the best rate of return on our investment. We're making investments in research, and how can we have the biggest impact, the best return for us and then for patients and their families? Well, if we know that 10% of all the cases come from this high risk population, and what if we can get that 10% into screening and surveillance and put them in routine monitoring? And we've seen this with other cancers. We've seen it with breast cancer, I mentioned that. We've seen it with colon cancers, right? So we've seen other cancers do this where you get those high risk populations into this routine screening and surveillance. What happens? Well, you catch early stage cancers, right? And now survivability goes skyrocketing up in a positive way, right? The other thing is you build awareness, right? People become more aware and they're more knowledgeable about the signs and symptoms of the disease, not only in the high risk group, but overall, because we're constantly talking about it, we're having these conversations. So we went down this road early on in 2018 at the University of Nebraska Medical Center. We helped establish what was at the time the first high risk screening and surveillance program west of the Mississippi. We followed that up in 2019 at the University of Chicago Medical Center in Chicago, supporting that program. 2019, we helped launch actually the PRECEDE study, which now has become one of the largest in the world. That's a 30-center program with 30 centers around the world screening high-risk individuals for pancreatic cancer. And then I mentioned earlier, 2024, we made the largest investment here in the state of Connecticut for pancreatic cancer research with Hartford Healthcare, $750,000. That was to help establish what will become the state's largest high-risk screening and surveillance program here in Connecticut with Hartford Healthcare. And that I'll just spend a minute on. Really exciting because, nothing against any of the other medical partners here in the state. There's a couple of them, but Hartford Healthcare, if you've looked over the last 5 years, I think since COVID, they really have expanded throughout the entire state. And so something that we're really big at Project Purple as well is equity and access to care. We hear that a lot, right? You probably see that in the news a lot, the rise of healthcare costs and access to healthcare. If you look at Hartford Healthcare's footprint, they cover the entire state, every community. Just in Fairfield County alone, they have like 180 buildings. So we were really excited to partner with them because at Project Purple, it doesn't matter where people come from. It doesn't matter their economics. We're here to support everyone that's touched by this disease. And when you think about high-risk screening, Nebraska was interesting. Like Nebraska is a two-town state. You got Lincoln and Omaha, that make up about 90% of the population. But then you have people that are 9 hours away, on the western part of the state. How do you get them to Omaha or Lincoln, right? That takes like a couple of days just to get them in there for screening and surveillance. Here in Connecticut, partnering with Hartford Healthcare, we could get everybody access to this. So it's really exciting. And this is kind of the conversation I've had with a lot of the legislative leaders, because I do believe the state needs to get behind it a little bit. I know the state has no money, but it's really fascinating because I think what we do here in the state of Connecticut with Hartford, and we have worked with Yale as well in a similar role and supporting their high-risk program through the PRECEDE study. But, what we do here can be replicated in other parts of the country and potentially other parts of the world, especially in Europe and in Canada with, the public healthcare systems. It's a lot easier to just flip the switch and just make it across the board, whereas here in the United States with multiple healthcare systems, that doesn't really work that way. So we're really excited to partner with Hartford Healthcare because, again, this gives everybody in the state of Connecticut access to this, regardless of where they live, regardless of where they come from. And so super exciting to be able to do that. When you look at the numbers, so, this is great, in theory and talking about it. I think I went too fast. Okay, here we go. So, what's really exciting for us since we started down this road in 2018, we currently have over 12,000 people across the country that we've helped fund in high-risk screening and surveillance, which is really, really wild. And what we're trying to do is really open the funnel. You need to really open this funnel really wide. We need like 100,000, 200,000 people in these screening and surveillance programs. So I'm going to start at the bottom. So University of Chicago, 720 people. The PRECEDE study, 10,500. UNMC, 770 people. So that was the first one that we opened. We helped open in 2018. So in that time frame, 770 people in screening and surveillance. So they are monitoring them. And what that means is first year, they're doing an MRI screening of the pancreas. So they get a dye contrast. The following year, they do an endoscopic ultrasound. So you're sedated and they go down with the camera and they look and see if they can see anything. So what they're doing, and this is the NIH guideline that's been created by the government, is every year they're alternating those two modalities for screening and surveillance. But here's the thing that's amazing. UNMC, which is our oldest relationship that we started this, they have found 10 stage 1 cancers. Now, not all of them have been pancreatic. 2 have been pancreatic, but there's a major, major, major difference in terms of treatment options, life expectancy of a stage 1 diagnosis to a stage 4 diagnosis. So we know this works, right? Again, that's why we've got to open this funnel. Hartford Healthcare, 180. So this is wild. And this is, here helping people here in the state of Connecticut. We gave them money. We announced it. We gave them checks a little bit before, but we announced it last November. They got the program open in January. From January to June, because these are June numbers, they identified 225 people in the state of Connecticut that reached out to Hartford Healthcare that were eligible for screening and surveillance. By June, they screened 180. Just in those first 6 months, they got one person at a stage 1 diagnosis of pancreatic cancer. So the survivability rate for stage 3 or greater is less than 6 months. So getting a stage 1 diagnosis is like hitting the lottery. I think it was like stage 1A, which means it's like borderline. It's just like starting the cancer, right? Which is like, again, that's also hitting the lottery in that sense for clinicians because that person becomes surgical. And their life expectancy skyrockets because of that. So again, we know this works. It's just a matter of like, how do we widen the funnel and get more people involved, get more awareness out there for people. And you are going to catch early cancers. And that's really something that we've been really invested in. And for us, when we talk about the dollars that we've invested, the money that we're putting into these programs, to know that we're catching stage 1 cancers, and we know that this is going to happen within this patient population, is massive. So that's kind of been our approach. That's what we've been really focused on. We'll continue to support centers here locally and across the world, quite frankly. We've done investments in other countries with researchers. And that's what we are really, really focused on is, how do we change this thing for families and patients as they battle through this evil cancer? And so that has been our focus in terms of research here over the last couple of years, and super excited to be here today to share. I mean, this is really, really exciting. You can tell we love sharing this story because this is how we are creating change. And hopefully in the future, more and more patients get that earlier diagnosis, which we know can make a big difference in terms of their trajectory in battling this disease versus those folks that get that late stage diagnosis. I just want to again thank the chamber. I saw Bill walked in here. Bill and I have been close friends. He's a dear friend of mine. He's not even just an associate that I know through the chamber. We become good friends outside. Unfortunately, Bill, we've had a lot of friends associated with the chamber, a lot of your friends, guys that I've become close friends. You've been a great connector, as you always do, but in this thing called pancreatic cancer. So it's really been an honor here today to talk to you guys about all the great things we're doing with research. As I mentioned before, if you're looking to get involved, look at to learn more about our events or what we do for patients, I would definitely suggest going to our website, projectpurple.org, or maybe following us on social media. We're everywhere now. Zach does a great job with the marketing team. But really, thank you to the Valley Chamber. You guys have been a great partner in what we've been trying to do as we continue to grow here in the Valley, but support patients not only here in the great state of Connecticut, which is a great state. There's a lot of things going on right now, but this is a great state. I've lived there my whole life. For those that maybe are new to the area, but it is a great state. I do believe what we do here in the state of Connecticut really can be the model for the rest of the world to follow. So thank you guys for the time, and really appreciate the opportunity to speak.
Some questions?
Yeah, absolutely. We have plenty of time.
Anybody have questions, comments?
Dino, so great, fantastic work. I can't applaud it more, but and so I'm curious, with the emphasis on screening, have you had any developments in prevention diagnosis? Do you know what causes it? Are you able to figure?
Yeah, so that's a great question, in terms of prevention. So I mean, there's a lot of things going on, right? And I think that preventing all cancers is a big discussion with a lot of these clinicians, believe it or not, a lot of researchers. I just had a call with the University of Nebraska Medical Center, and they were talking about it. I mean, they have a big, there's a lot of diabetes in Nebraska, believe it or not. I think a lot of it's related to diets. So I think everybody in the sciences is starting to look that way.
Okay.
In terms of how do you prevent a cancer from coming?
Right.
Genetics, understanding genetics is, I think, one piece to that, right? Like understanding, your genes and what maybe you can do for that, potentially changing lifestyle habits. I mean, there's been so many studies recently about like the negative aspects of alcohol, right? Consumption, right? And now we're starting to see alcohol consumption, and hopefully no one's here with any distributor.
Right.
Alcohol consumption is just plummeting, right? We're starting to see more data on diet, right? Like, what actually people are, processed foods, heavy processed foods. We've known from studies, you can give a lab mouse, high carbohydrates, like super processed foods, and you feed them, you get them really, really fat, and give them the same diet of these high processed foods, and they get cancers really quick, right? So we know that, right? So it's just a matter of, how do we get this awareness out and the messaging? So I think to answer your question, I think the whole healthcare space is kind of going in that direction. Just don't know how fast it's going to change. in terms of lifestyle, I think there's been a lot of lifestyle stuff. I heard, yoga and Pilates are in here, stress is another thing, right? Technology, right? Like, what are the impacts? I mean, I've seen studies where, not related to pancreatic, but, young kids, girls getting breast cancer early because what do? They put the phones in their sports bras, and kids have laptops on their laps, and the testicular rate for boys is like skyrocketed in teens, which we haven't seen in the past, So you're seeing all these like crazy cancers, colon cancer. I was just at an event the other night in the city, and not to name drop, but she brought up Katie Couric. So Katie Couric lost her sister to pancreatic cancer, lost her first husband to colon cancer. She's been a real like loud voice for colon cancer. And I was talking to her and she was like, there's like this massive rise in colon cancer rates in young people. Why? And we both kind of agreed maybe it's what we're all ingesting, diets, because but also the screening and surveillance for colon cancer has dropped too, down to like 35 for high risk groups. So now there's talk that maybe even drop it down to 25, which is fascinating. But why is that happening, right? What's changed, in the last like 20 years? So I think diet and prevention and like just all these things, I think it's like a culmination of the fact, at least in my personal opinion, from what I've seen. But I think the space is trying to go there. I think it's just hard. Like, it's hard. How do you move?
It's a lot of correlations, but not causation studies, yeah.
If I wanted to share a personal story, if I could, with Dino, we have had a long friendship, but it was 15, 16 years ago that current board chairman Rob Lesko said, Bill, I want you to meet a friend of mine starting a new foundation. His dad is suffering from pancreatic cancer. That was in June, I think, of whatever year it was. The fast forward Friday before Labor Day, I called Dino and I said, Dino, is there any room on your half marathon team? This was from the annual New Haven half marathon on Labor Day. And he said, Billy, he said, bring your check, meet me on the New Haven Green at 7 o'clock. I'll give you your shirt. When I arrived on the green, I said to Rob, where's Dino? He said, he's not coming. His dad passed away that morning. His dad passed away that morning. I took that shirt and I joined with 25 others and I said, now I know why I'm running. Right now I know what I'm running for. And we have been dear friends ever since. So I have run with this man. I have played in this golf tournament, played in this pickleball tournament for the last years. My partner on the call this morning. This is last Saturday. I've been a judge at his pizza eating contest. Gag. And this is the message I want to leave with you. I have referred many wonderful leaders from this community that have been diagnosed with pancreatic. And I'm going to name them. Kevin King from Ion Bank, who had about a 6 or 7 year battle, connected him with Dino. He became such a dear friend and mentor. He had the support system that Dino offered, the connections all over the country. Dave Kelly, chamber director, dear friend of mine. I miss him so much. And his boys were in the pizza eating contest, right? And he was the honorary guest. He was the honorary guest of that with Jazz and AJ. Alan Tyner, former chamber chairman here, a gentleman lawyer, passed away in 4 months. 4 months after his diagnosis. Once again. And then Billy Bassett, who just passed as well. So I urge you, if you come in contact with folks that have been touched by this, to connect with Dino with his support system. I just marvel at what you have done to take your grief and to channel it into something so powerful. When I saw the wonderful piece, Laura and I said the wonderful piece in the paper this week with Harvard Healthcare, talking about the $750,000 that we provided to them. And to see your picture there was so heartwarming. So congratulations on that. Amazing job. Thank you so much.
So first of all, amazing presentation, amazing mission. Question for you that I have is, I'm actually a stage 4 lymphoma survivor. So, kind of talking about cancers that maybe don't get as much recognition, and there's, breast cancer who has a lot. kind of figuring out the ways to navigate and finding funding for, there needs to be funding for every single one, essentially. But, how do you navigate kind of through that and like figuring out how to find the research and being able to get the funding in order to create the awareness around ones maybe that aren't as highlighted as much as others?
Well, first of all, thanks for being here, and it's great to have a survivor. Yeah, that's a great question. I think for me, there's always been, there's a lot of terms under the stat, like it's not rocket science, but there's a science, and I think for us, it's always been about awareness.
Yeah.
Like you gotta build awareness, and the money will come and, we'll figure out the rest. I mean, I think for us, like, yeah, there's a lot of noise and, it's also a rare cancer. 68,000 is not a lot of people, and so technically from a stat, it is a rare cancer. I think 100,000 is really where the government looks at it as like more of a broad cancer. So sometimes we do get lost in the shuffle, in terms of the messaging and in terms of funding and in terms of advocating.
Yeah.
And I've done DC, I've done, Harvard, not what we specialize in. I've gone personally, if I can help the effort. But I think we really focus on the impact we can have.
Yeah.
I think that's where I go back to that slide, with this medical research committee, like we created this group. We were trying to have the biggest impact. Right now, what we realized was there's a lot of research that's not getting funded.
Yeah.
So how could we have that big impact right now with the dollars that we're investing? So I think that's another thing for us, that we just are really hyper focused on our mission at hand and the impact we can have and raising awareness. I think that's been really critical for us and part of the success that we've had. And I think the other piece, and this is for everybody in the room, nothing comes easy. You got to work really, really hard at it. The success we have had and the success we will have is because we're working really, really hard. It's not easy. You get more no's than yeses, but so what? We gotta move on.
I'm assuming you have to start somewhere, so when you were starting, most people say, okay, I'm not gonna work. So if you're passionate about trying to do something about lymphoma or something like that, hey, did you start out small and just a small business while you were still working?
So great question and interesting story that I haven't told often, but so I had that insurance brokerage and I had 5 employees.
Yeah.
So I ran that business into the ground because I realized my passion wasn't, and I was really good at it, selling insurance and making it, which at the time was a lot, I thought it was a lot. That's all relative. I just was not passionate about it. So that did allow me the opportunity to kind of spend most of my time Project Purple, which was 100% volunteer at the time, but
Yeah.
I also was like paying for like stuff from the other business to help start this business. But yeah, that was really kind of, I think, a big thing for me. It was just time management in the beginning. I also had 2 young kids at the time, so like life was a little bit hectic. I got a lot of stuff done between like 4 a.m. and 6 a.m.
Yeah.
But you figure it out.
Yeah. Thank you.
So I do community outreach. I do between 15 and 20 blood pressure clinics a month. You have literature that I can hand out so that.
Yeah, I can get your email or something, I can send you over. Yeah.
Yeah, because I can put them on my blood pressure tables. Yes, a lot of it is the senior population, but not all of it is. But I can definitely help. I'm a breast cancer and uterine cancer survivor, so this also, genetics
Yeah.
is a big part of this. I am convinced of that. So that if you end up having one cancer, in the back of your mind, you're always thinking, what else is going to happen? So I would like to do something about this. Is there a month that is breast cancer?
We're
That's one of us.
November. That's why I'm here.
Better month, so it's not diabetes also.
I think now, like, we just realized, so yesterday was World Pancreatic Cancer Day, but it was also like multiple days. I think every day, every month is now.
There's always
So
something.
how do you find like,
Yeah.
you gotta kind of bob and weave a lot, and kind of find like, yeah, every day is something. Every month is something, so yeah, but absolutely, and I think the other piece to this too is, I just leave with this is like, so this is not just an old person's disease.
No.
We do a podcast and yesterday I had a lady who was like, the last 6 months, I've probably had 10 people under the age of 45. From 45 to like 28. And so there is some statistical analysis, because I've been asking a lot of our other partners and some of the other larger groups like American Cancer Society, which is a great organization, by the way. They put out a lot of the technical data on like cancer cases. And I didn't ask my counterparts there, like, you know, can we dive in a little bit deeper? Because it seems like more and more young people are getting this. So I would, you know, the old like adage was like, oh, this is just a grandparent's disease. That is not the case. It impacts everybody. So just, and the other piece to Bill's comment, you know, we are working on some things, but if you have someone in your community or in your personal community, your professional community that does get diagnosed with this, just reach out to us. I can leave my business card. We're more than willing to help them, guide them through that journey, unfortunately. But we also have a big survivor network. We are really, really big into our survivor network. We call them superhumans because they all are superhuman. And so a lot of them love to mentor. And I think when for the cancer survivors here, as you go through that journey, you know, talking to another cancer survivor is a lot different than talking to a relative that has never experienced cancer, right? So I think that's like a really big piece. We are working on some things to get that out to the public, but in the meantime, again, if someone in your community personally or professionally is impacted by it, by all means, we'd love to talk to them and help them in any way, not only from our program standpoint of financial aid and support, but just from the emotional standpoint. And then also from, I always tell people, you know, it's a much different conversation for us because we write checks. So when we refer patients, we can get patients in the door a lot faster than, you know, someone just calling a 1-800 line or reaching out.